So I'd like to start off with a little bit of an introduction of each of us as well. I'm Shannon Schrader. I am a sixth-year clinical psychology PhD student at George Mason University, and I'm currently on my clinical internship at Yale School of Medicine in the Substance Abuse Treatment Unit, the secondary placement at the Consultation Center. And I'll just pass over to Dr. Kelly Moore for a quick introduction.
Hi, thanks, Shannon. I'm Kelly. I am a licensed psychologist and assistant professor in the psychology department at East Tennessee State, which is in Johnson City, Tennessee. I've been a faculty member here for the past 4 years, and June, who will introduce herself next, was my advisor in graduate school. And I worked briefly with Shannon, but both when we were graduate students. So I'm really excited to be back here with these guys presenting about borderline personality. And my area of research is actually in stigma, as it's tied to having a criminal background. But I've been really interested in borderline personality and how individuals with this sort of symptom set, how they do with the justice system in general. Passed over to June.
And I'm June Tangney. I'm a professor of psychology at George Mason University. And I have been so fortunate to work with so many wonderful people, including some of you here. So this is exciting.
Okay, great, thanks. So let's go ahead and jump in then. So just a quick outline. We've already gone through introductions. The content of our workshop today involves borderline personality disorder symptoms and the criminal legal system. So we'll discuss kind of the criminal legal system more generally, as well as BPD itself in correctional settings. We'll talk about adjustment during incarceration, as well as different challenges that come up during the reentry time period. And then we'll wrap up with recommendations for a wide variety of audiences, including frontline staff, clinicians, family, and friends. And then we'd like to, with the remaining time that we have left, just sort of open up discussion. You know, if anybody has comments, suggestions, wants to share any anecdotes, lived experiences, we'd love to open it up for that at the end. So I'd like to start off with sort of passing to Dr. Tangney, who will start us off with information on the criminal legal system more generally.
Yes, so we thought we would cover this a little bit because I was clueless when I first started doing work in this area in criminal justice about how the system works. I mean, to me, jail and prison was the same thing. We just used them interchangeably, and I knew that when people got arrested, they ended up in jail or prison, kind of the same thing. It turns out we'll be talking a lot about jails separate from prison, and that's where most people spend their time and where most people then re-enter the community from. I wanted to lay this out because one thing we found is, well, certainly this is a big part of our mental health system, unfortunately, and we found that the rates of BPD are very high among people who are cycling through the criminal justice system. So as it works, when people are arrested, they initially go to jail. They rarely go straight to prison. I mean, that just doesn't happen. So jail is the first stop. Jails typically are in either larger cities or located as at the county level. So they're local. It's the entryway into the criminal justice system. It's where people spend time pre-trial, pre-sentencing while they're waiting for the wheels to turn. Sometimes they bond out for a while. Sometimes they come back. And then once the criminal justice process has completed and there's a sentence, if the sentence is less than a year, people typically will spend that year or whatever time left to serve in the jail facility locally. It's really quite a small chunk of people who go through jails, who are arrested, who then are sentenced to more than a year. And that's typically when people are transferred to typically far in the distance state or federal prisons, depending on the nature of the charges. Okay, and why are we spending so much time talking about jails instead of prisons? Well, it turns out people spend a lot of time in prison, but they're not moving in and out. If you think about admissions, they're pretty close to the same number as people who are leaving. So in a typical year, nearly 12 million people leave jail and rejoin the community, whereas less than 1 million, about 0.6 million, people leave prison to rejoin the community. So if we want to have a real impact and look at the experiences of people with BPD, we want to look at jails. And that is what we focus on in much of our research. Just a little background. So as I mentioned, many people involved in the criminal legal system have significant symptoms of borderline personality disorder. BPD symptoms are overrepresented in correctional settings. So just to give you an idea, people who meet criteria for BPD, it's about 2.7% in community samples, between 15 and 30% in more clinical samples. And when you start really looking at inventories in jail settings, it could be as high as 50%. And that may not be surprising if you think about some of the characteristics associated with BPD, impulsivity, difficulties with emotion regulation, dysregulated anger, that puts people at risk for becoming involved in the legal system. Also, there are comorbidities with substance misuse, which also may bring people in contact with the, I like to call it more criminal legal system these days. You may be wondering, are there particular kinds of crimes that bring people with BPD into the criminal justice system? And we've done work on this in one large sample and have found that actually not really. People with significant symptoms of BPD enter the criminal legal system really for a variety of different kinds of offenses. It doesn't, no particular ones stand out. And now I'll turn it over to, who's next?
I think I'm going next, right, Shannon?
Kelly, yes.
Okay.
Yes, over to Kelly.
I mean, if you can think of a worse place for somebody with high levels of BPD symptoms, can you think of a worse place than a jail or a prison?
Yes. All right. So I will take over from here. So, like June said, we know that people with borderline personality symptoms or who meet criteria for borderline personality disorder are overrepresented in the criminal legal system. They're oftentimes incarcerated, so we see high prevalence rates in that system. And there's been a little bit of research looking at how they adjust to incarceration. And so it makes sense that, you know, anybody who's struggling with mental health in general, we know that jail and prison is not the most nurturing, supportive environment for anybody with a mental health problem to go. We've known that for decades. And so especially, you know, somebody with borderline personality symptoms is no different from somebody with other mental health problems in that sense, that the jail or prison environment is not going to be necessarily the best place for them to be, to get access to quality care, and to you know, adjust to the nature of this environment, which can be pretty difficult. And so there's been some studies looking at this, and the research is a bit mixed with regard to whether people with borderline symptoms do have more difficulty adjusting during incarceration. There's been a couple of studies have shown that there are increased problems, maybe interpersonal problems with staff or other people, other incarcerated people potentially more disciplinary infractions. And we know that some of that might be due to the fact that when people are struggling with mental health symptoms that are not being treated, we see more behavioral problems in these sort of correctional settings. And they may, you know, for people with borderline personality symptoms, connections and relationships are critical, and the lack of that during incarceration can be very challenging, and the lack of contact with supportive people in their life, that can be a very difficult adjustment. So there's a lot of things about carceral settings that make it very, very difficult for people with borderline personality to adjust in those settings, and we know also that there's just a lack of, sometimes there's a lack of good quality mental health care available in these sort of settings, especially jail settings, like June was talking about, that are more short term and have many people cycling through.
And one thing I want to mention is that some of Jen Loya's really groundbreaking work here shows that people with high rates of BPD may have a special difficulty adjusting initially at the beginning, at the outset of incarceration. But this doesn't seem to be something that persists over the long term, where it's just difficulty adjusting throughout the course of incarceration.
All right, and so that's a little bit about what happens during incarceration, and I think we need more research certainly in that area, which will be a theme throughout everything we talk about today. More research is needed to really understand the experience of people with these symptoms in these settings that can be really challenging. But we want to talk a little bit about reentry, because it's one of the time points and pieces of the criminal legal process that tends to be the most challenging for individuals, you know, regardless of whether they're reentering from prison or jail. If you know anything about working with these settings, and it seems like some of you all here in the audience are with Department of Corrections and other sort of criminal legal systems, you probably know that reentry can be a chaotic and stressful time, an overwhelming time for anybody who's involved in this sort of system. There's a lot of different potential challenges that people are facing, and you know, some of this depends on how much support did somebody have going in, you know, to the system. But for many people, they may even be struggling to meet their basic needs of finding a safe place to stay, you know, finding housing or shelter, having enough money to buy food, having proper clothing and toiletries and things like that. And then certainly there's oftentimes problems with transportation, getting to and from places that you need to be, like meeting with your probation officer, going to job interviews. Finding employment is usually a struggle. I think it's pretty rare for people to have a job lined up when they're incarcerated. And so many people, when they're getting out, are having to kind of restart that process of finding employment and finding a way to support themselves and their families. And then on top of all that, many people are also trying to stay sober from drugs and alcohol. We know that, not even looking within borderline personality, but just in general, people who are incarcerated, I mean, up to 60% of them have substance use disorders. And so we know that this is a really common problem that people are struggling with. And it's something that most people are trying to manage when they re-enter the community, which is difficult when you're bombarded with tons of really challenging obstacles and stress, right? For anybody who's struggling with substance use or mental health problems, that can be a challenge. And then complying with probation is a whole other issue that people are struggling with at reentry. So meeting with probation officers, paying court fines, doing all the things that probation is telling you have to do. I'm gonna go to the next slide. And so we really don't know much about people with borderline personality symptoms and what the reentry process looks like specifically for them. We do know there's been a couple of research studies showing that having BPD symptoms make it more likely for somebody to return to incarceration, or they make it, they increase the chances that someone's going to be reincarcerated. They might have a shorter time to reincarceration after they're initially released. So we do know that having these sort of symptoms can make it more difficult for people to adjust in the community, because we see those rates of recidivism that are a little bit higher when people have borderline personality symptoms. But the reason for that is we really don't know the reason for that. We have some ideas, or researchers might have some ideas. The same sort of symptoms that might put people at risk of being arrested in the first place can be a challenge when people are leaving incarceration and reentering the community. Struggling with impulse control, being in relationships that are potentially harmful or toxic, having interpersonal difficulties with people that might escalate and lead to arrest, substance use. I mean, there's all sorts of ways that people in general, and especially people with borderline symptoms, might really struggle during this period of reentry, which is already stressful and overwhelming and chaotic for any person that's going through it. And so, some of the other symptoms that may potentially be relevant here are distress tolerance. We know that people with BPD tend to struggle with that. And if you can imagine all of the stress that you're under when you're reentering the community, I mean, that would be challenging for anybody, and especially somebody who struggles with tolerating distress and not engaging in maladaptive behaviors when they're experiencing distress. So those are some things that, I think we need to look more into in the research and better understand to really understand how people with these sort of symptoms do during the reentry process. So I think we're gonna talk about interventions, and then we're gonna shift into some recommendations for what to do. What do we need to do to best support individuals who have BPD, who might be involved in the system? And so just a little bit about interventions. I'm sure a lot of the other content in the conference has addressed this, but we do have interventions that work pretty well for addressing BPD symptoms. DBT has been around for a long time. It's been modified for correctional settings, though I think it's mostly been used in prison settings. I don't know if DBT Corrections Modified has been implemented in jail settings. And part of that is due to a lot of those extra barriers that jail settings have, like limited resources and people moving in and out, like June said, and also just, limited staffing and finances. And it's difficult to provide people treatment when they're in jail settings. And so we have some solid treatments. We've also got some newer treatments like mindfulness modification therapy and other sorts of briefer mindfulness or skills-based therapies that may be really helpful for people who are struggling with borderline personality symptoms. But the implementation barriers for getting those treatments into these systems, there's been a ton of them. And so they're not widely used at this point. I think they've been more broadly used in prison settings than jail settings for sure. And so in terms of recommendations that are specific to reentry, I think that, anything that we can do to proactively think about how somebody is going to be transitioning from incarceration to the community and the struggles that they're going to have, anything we can do to support them through that transition is going to be helpful. And the reentry literature in general, not specific to BPD, basically says that, this is something we need to be thinking about when people are incarcerated, and we need to be making a plan so that people aren't just being released without any sort of connection to supportive people or mental health care or medications or anything, or housing or transportation. So the more we can kind of proactively anticipate the struggles that people are going to have, the better we will do. There's some really innovative models right now that are being developed. One of them is Transitions, the Transitions Clinic Network. This is not specific to BPD, and it's not even specific to mental health. It's more generally a healthcare model, but it's a hotline that people can call and get connected with healthcare when they're leaving jail or prison. And that's really critical because like I mentioned, reentry is a really chaotic time. And when people don't have supportive others in their life or they're struggling, it can be really hard to access adequate care. And so that something like this could be really useful for this population. And I will mention that it's not necessarily about having more intensive legal supervision, but just connecting people with higher quality care, because I think that the research generally shows that the more we start hovering over people as they're re-entering, the more they violate, the more we find that they're doing wrong, and the more they go back to jail. So that's not necessarily better, but making sure people get connected to care. And then the last thing I'll say before I transition over and pass it over to Shannon is just that there are some really cool new reentry simulations that are being rolled out that basically help people, whether it's professionals, community members, anybody, understand what it's like to re-enter the community after incarceration. And so I have a link up here that you can check it out. There's not actually a video of the simulation. It's like an elaborate thing people do that they participate in, but it's a really cool new thing, and it teaches us basically like how hard this process is, and it helps us understand what people are struggling with and how to best support them. The other things I think are really important to consider are stigma reduction. There's been some really cool work in this area, trying to reduce stigma associated with the BPD label among providers, which we know is really important in community settings. And then also, not to forget the stigma that's tied to criminal involvement, because a lot of community mental health professionals hold that stigma as well. And so making sure we're not judging people with BPD who are coming out of the legal system for that criminal involvement. And the final thing I will say is that involving people who have that lived experience, peer navigators who have had BPD, who have struggled with this, maybe even those who've been involved in the legal system, that's a really potentially useful way for us to support individuals with BPD in this system. All right, I'll transition over to you, Shannon.
So continuing on with recommendations, so outside of folks involved in the reentry process, so some recommendations for clinicians working in the field more generally. One of the big things that I think comes up is proper assessment. So research has shown that over a third of individuals with borderline personality disorder have a reported history of criminal justice involvement. So assessing for criminal legal system involvement, either current or prior history, is really important and kind of should be, even in community settings, should be asked about, so that we can sort of recognize that patients that we're seeing with BPD symptoms might be at higher risk for criminal legal system involvement, either in the present or in the future. This isn't maybe necessarily information that people will think to volunteer in an assessment, and I think is something that's left off of a lot of assessments that we conduct in general. So I think assessment's a big piece here as far as recommendations for clinicians working in the field. We also have recommendations for correctional staff, so folks who are working on the front line in jails or prisons, who are undoubtedly going to be working with folks who have BPD symptoms. So frontline staff, both awareness and training are really important. So just so that staff are aware of what BPD symptomatology looks like, so they can identify it. And then even just some kind of basic clinical skills training can be helpful in interactions with incarcerated individuals with BPD symptoms. So even just training in terms of validation, what is a validating statement versus an invalidating statement? What's an effective way to de-escalate, somebody who might be emotionally dysregulated? So just sort of both awareness and training for frontline staff in correctional facilities, as well as, Kelly talked a little bit about this, but adoption of the new interventions that can help individuals with BPD symptoms adjust during incarceration. So that might be modifying existing treatments for justice-involved populations, so to be able to fit into these parameters of a jail environment, this revolving door, where we don't necessarily know when folks will be coming and going or how long they'll be around, and can't necessarily complete a full DBT treatment. There's not the staff to be able to do coaching calls 24 hours a day, 7 days a week. So potentially modifying things like STEP, which is systems training for emotional predictability and problem solving. It's a 20-week group therapy that includes a wide variety of folks, including family members, friends, correction officers, and staff in the treatment itself. Of course, 20 weeks would be hard to implement in a jail setting, so being sensitive to those sorts of restrictions in a jail environment, and being able to modify it appropriately. Some recommendations for family and friends. So the support network of individuals who have borderline personality disorder symptoms who are incarcerated. As Kelly touched on a little bit earlier in the adjustment during incarceration piece, is that contact and creating and keeping these interpersonal connections with individuals is really important during incarceration. Maybe perhaps even, there's not really any much research in this area, but perhaps even the psychoeducation or perspective taking around the experiences of those people who are incarcerated, as well as the challenges that they'll face during the reentry process. And that perhaps having family and friends and support groups where other people can share experiences and that sort of thing. Kelly also talked about kind of this dearth of research in this area. So we have some recommendations for people who are conducting research in this field as well. Really kind of as a general blanket statement is that additional research is just needed on individuals with BPD in the criminal legal system. And this is kind of at all stages. So on how they enter the criminal legal system, how they adjust during incarceration, as well as how they fare during reentry and what predicts failures versus successes in the reentry process. Virtually no research exists on the relationship between BPD symptoms and reentry success. So more research is needed kind of as a global statement in this arena. No, we only have actually a few minutes left. We'd like to just open up if anybody has questions, comments. This could be really anything, individuals' lived experience, like things you might have wanted your family, friends, correctional staff, clinician to know, or family, friends, clinician, staff, if anybody wants to share suggestions or experiences, anecdotes, thoughts. The chat is open if anyone feels more comfortable sharing thoughts or comments anonymously. You can go to menti.com and put in this code and it'll send it to me anonymously and I can read it off. Or if people just want to pop in outside of the chat, that would be fine as well. Yes, I'm seeing a comment from Katie. So in the Connecticut system, triage inmates as soon as they come through the jails. If they need a higher level of care, regardless of charge, sentence status, or security level, they transfer to one of our prisons, which is designated as the mental health hub of the state. That's interesting. So the research that we've conducted is in the DC area, and they don't transfer to prisons based on mental health status. That's interesting.
Right, but I do want to point out that much of the work that we've been citing in our own work has been with general population inmates. And so these are people who are not experiencing such severe symptoms that they're moved to a forensic unit, for example. This is your average jail inmate, and we're talking, as many as 50% who are really struggling with some of these difficulties with emotion regulation. And it's a substantial number of people who don't get into settings where they're likely to get long-term treatment.
I think we may have time for one more comment, question, or anything anyone would like to volunteer.
I just want to thank everyone for coming and for thinking about these issues. And also to, I think just generally, I don't know, I was never taught to ask about criminal justice involvement. And I don't think this is just something specific to people with BPD symptoms. Why is that not a routine question? Because it certainly does have an effect on people, and for a lot of reasons, you know, they don't volunteer it. It may not seem to them relevant to what they're doing in therapy or what have you, and then there's the stigma associated with it. So just asking that along with, you know, asking about drugs and alcohol and suicide and criminal justice involvement.
Yeah, and then I popped my email address in the chat if anybody wants to reach out and talk about anything further. Be happy to talk. All right, so I think we're at 4:15, and Gabriella, that's when we're supposed to be wrapped up by?
Correct. Yes.
All right.
4:15, and then we are due for a bit of a break before popping back into the main conference area to hear Brandon Marshall talk. Yep.
All right, perfect. Well, thanks again, everybody, for joining us. Reach out if you have any questions or want to talk about anything further, and enjoy the rest of the conference.